A very warm welcome to you. Thank you for joining us on Health and Wellness. My name is Zaitun Ali, and today we're coming to you from the Hotel Troy right here at Mombasa Road in Nairobi. And the topic of discussion is aplastic anemia. Most of you know about just anemia, but today we are narrowing it down to this specific condition. And on set, to explain further about this, we have Dr. Gitau, who is CEO and founder of Msafiri, Daktari Msafiri, right? Karibu sana. We also have Stephanie Achieng, who is a mom to an 8-year-old suffering from this condition, and she will get to tell us her experience with her daughter. Welcome.
Thank you.
What's your daughter's name?
My daughter's name is Ayla Milan.
Nice. And Ayla has joined us today on the show. On my right, she's seated here. Karibu sana. And we also have our audience. So we're going to build up the conversation at the second part of the show. Welcome to the show. Daktari. And we all know about anemia.
Yeah.
But aplastic anemia. Talk about that.
So the first thing, maybe as a part of the introduction, is just to basically when people hear about anemia, there are different types, and aplastic is one of them. It means that anemia just means reduced blood cells.
Okay.
And in this particular case, when you're talking about aplastic, anytime you hear the word aplasia, I'm sure most people have heard aplasia, metaplasia. Those are they sound like very big words.
They are.
But basically, aplasia means just something didn't form, or it started forming and then it didn't complete to form. And that's what it means. So when you have aplastic anemia, it means, because from anemia, the way we get our blood cells, so there are different types of blood cells. So you have white blood cells, red blood cells, and mostly platelets. So all these are formed in the bone marrow. So if the bone marrow is not able to form the cells, then that's when one of the conditions that may actually be causing this kind of anemia is aplastic anemia, and that's what we are discussing today. Yes.
Welcome so much, Stephanie.
Thank you very much.
And I know Ayla has been going through this condition for how long now?
This is her 5th year,
Okay.
but for the past 4 years, we were very sure what we were dealing with. Let's say around last year, we were very certain, because the frequent ins and out of hospital, all the rest of the other years, we all knew that it was just anemia.
Okay.
We would go to hospital, the doctors will tell us she has a low blood count. Majorly, we would just get medication for it. The doctors weren't really doing, I'm not going to put a blame on them, but as of now where I'm at, I feel like if they would have put in a more further research on what was going on with her, because we've as parents, most of us can tell that they take their kids to hospital and they're told your child has an iron deficiency problem. All they get is the syrups and whatnot, and then the child will be okay. But for my daughter's case, it was more of she gets medication, lasts for a month or two, we go back to the same story. It was over and over and over again. So I feel like this is something maybe as parents, mothers, we tend to believe so much on doctors say. A doctor will tell you this is what it is, but it's also our job to also dig deeper. Yeah.
What kind of symptoms was she going through?
So when she was around 3 years of age, I took her to the hospital, and that was the first time we were told that your daughter has a low blood count. But as of that moment, when they didn't see it as something very serious, so that's why we were just let go with some medication. At age 5, mind you, the age of 3 to 5 years old, it was more of those getting iron supplements. She also had a situation whereby her growth was an issue since birth. She was born with 2 kilos. A week after birth, she lost weight, 8 grams again. So it was alarming. Personally, it wasn't something I could speak of, but with the ongoing ins and outs, it reached a point where now I was like, okay, something is going on.
Yeah.
So this one time, she was almost 6 years old. She was just her normal self. It was just a normal day. I was just heading out to the market, and then I just stepped out. I wasn't even further from my house, and then my house girl shouts I just hear her, Mama Ayla, your daughter is bleeding. The first thing I just thought was, okay, she fell down. Because she never had she wasn't sick. She never had any situation where she was convulsing or anything. So she was nose bleeding. It was a continuous flow. You know, there's the nosebleed where it's just a clot.
Yeah.
But for her, it was quite serious. So that is when I started panicking. You know how you can panic as a mom and see, okay, something is going on. I took her to hospital. But what they did, they just did the usual medication, the drips. They just she was just given some boosters and whatnot. And at no point did they say that this is aplastic anemia.
Okay.
What they just said was she's having low platelet counts. Now the platelet situation was that the medication she was getting at the time would aid her. But there was a chance that she was supposed to get a transfusion, which she didn't. Now, my ugliest experience was me trying to get the answer, because Ayla has been in 95% of hospitals in Mombasa. It was, I really can't say that I failed. It's more of, I felt like I have to get the answer. No matter what hospital it is, I have to get what is going on. My daughter is not just sick. So this went on until last year. So last year it was very bad. She also had situations where she was fainting. We noticed her frequent, she gets tired very fast. She would run like a meter long. Her heart would beat very fast. And at that very moment, she would just turn pale. She gets sweaty at night. So there was more of me getting her medication over the counter from the doctors, from nutritionists, all the boards of doctors. I used to work with them. So this year the same thing happened. It wasn't a pleasant thing to experience as a parent with your child, because you're getting judgmental eyes from parents, because you see your child is of this age, she does not look that age. She's very small. She does not feed as usual. She does not go around with other kids as usual. So there was a lot of challenges bringing her up. This year she was admitted at a specific hospital in Nairobi, and they had to do a bone marrow aspiration and a bone marrow biopsy. Now those two tests were can I say it was the it factor for us to know this is what it is. Because the hospitals were telling us it could be, it could be, it could be. As a mother, you don't want to hear that. You want to hear this is it. So once those two tests were done, it was clear that now this is aplastic anemia. Myself, I did not know what that is. I know of anemia, but aplastic anemia. So I did a lot of research. And I understood I had to do some research. So,
okay. Daktari, we can talk about the symptoms that come with the aplastic anemia, and what's the discrepancy? Is it just a part of anemia itself, or it's a part of anemia itself?
Yeah. So as she was talking, you could hear.
Yeah.
And as I said, since the bone marrow is the one which has a problem, so it will affect all the different kind of cells. So if, for example, the red blood cells are affected and you have very little of them circulating in the blood, that means your blood level goes down. And the symptoms they will present with is now the typical anemia symptoms, where you get easily fatigued, like she was saying, you walk for 1 meter, you get tired. So those are like they're not able to play outside because of getting tired. Sometimes they heart beat very fast. because their body is demanding for more and the blood is not enough. So more oxygen, but the blood is not enough. So their heart beats a bit faster to try and compensate. If it's, so then they also get, sometimes we've seen people get shortness of breath because of just the low blood count. And then if it affects the platelets, those are concerned mostly with they help with the clotting of blood. So these children, anytime, even a small bruise, they're likely to bleed a lot. Nose bleeding becomes very common, and you can bleed from any of the orifices, just even without any, even with a small bruise or even without. So usually when someone starts bleeding, they would stop bleeding very fast. But if the platelet levels are very low, then that will get affected. Then in case the white cells are affected, white cells are involved with protecting the body against infections. So we realize that most of these children or adults will come to hospital frequently with recurrent infections. So these are the children who will be getting, anytime there's a flu going around, they come. Even when there are times when everyone else is okay, they'll still get recurrent infections. So they're always in and out of hospital because of these recurrent infections.
Okay. And does it really get to children mostly, or even adults can get it? Who is
So it's
prone
both.
to get it?
Majority are in children, but also we see a lot of adults with the same. And this mainly is because of also what causes it. So you find like about 20 to 25% of people with aplastic anemia will get it, either will inherit it from their parents. So most of the time it will present when they are young. But the rest of 80%, there are conditions that people get, and that's what causes them to have aplastic anemia.
And like Stephanie had mentioned, when she was born, she was like 2 kgs.
Yes.
So did the damage happen at birth when she was giving birth to her, or did she acquire it later on in life?
So it's difficult because there are tests which can be done to determine whether it's a genetic or it's an acquired condition. So it's difficult to know, but it's likely, since she's had the problems from when she was very young, it's likely there's a genetic involvement. Now there are tests that are available to determine if a person actually has any genetic predisposition. So you'll find if maybe you search in the lineage, probably there are people who had the same condition, maybe it was never diagnosed, or maybe even their symptoms were not as severe, and maybe they were managed as something different. So it's important that also that we get that history from the family. Are there other people with similar conditions? Because also can be something that could be passed on from the previous generation. But also there are conditions that even children can get when they are young. So, and some of them are like viral infections. There are certain viral infections. Common is one of the viruses called parvovirus. The other is called Epstein-Barr virus. So in case somebody gets any of those viruses infections, then that can trigger the cells or the bone marrow to stop producing the white cells. For people also born with cancers or childhood cancers, we've also seen, in case they go for treatment, so the chemotherapy and the radiotherapy, that can have an impact on their bone marrow, and that can cause their bone marrow not to produce these cells. So they tend to get that condition from that. We've also, in most of the cases, we try to look for solutions, and we're not able to get anything. So we do all the tests, we check, and you can't identify what is causing this. So we've had cases where we're not able to get it. Aplastic anemia also tends to occur most commonly with other leukemias. So people who have the one we call ALL, acute lymphoblastic leukemia. So you'll find some children or adults will get ALL, but at the same time they have this. So it can occur also with other conditions that are there in the blood.
Okay.
Yes.
And perhaps, Stephanie, have you done your research in terms of looking at, is it genetically inherited? Was anyone in your family with such?
Right now, currently, she's under that test. She did a test called a chromosomal microarray, and she's expected to also do a next generation sequencing test. Those two tests are those that will be able to tell us whether it's from the bloodline or she acquired it, because right now we are in that journey. She is expected to also go through a bone marrow transplant in India. So those are the tests that are needed to be done in order for us to proceed into the bone marrow transplant.
And since diagnosis, has the treatment plan maybe improved? Has her condition improved? Have you seen change?
There hasn't been a lot of changes because she has not yet, that is really the only cure. Medically, a transplant is the only cure. What the doctors have done is to do, what do they call it? Something care. They just work a supportive care. That's what they call it. They call it the supportive care. They work on what is visible as for now.
Okay.
So what is needed is the bone marrow transplant. So right after those tests that I've told you about, then we will know. Because there isn't really much the doctors can do right now.
Okay.
Yeah.
What about school? How is she performing?
She's a very joyful child.
Nice.
People really like her being around them. It's just sad that, as you can see right now, she's in a mask. There are certain things that she cannot experience as a child. We need to monitor how she plays with kids. We need to monitor where she is. We need to monitor the kind of food she's getting. You know how kids can be around each other, they share food and whatnot. Why I'm saying this is because small injuries can trigger a lot. If she can get a small bruising, that's it. Things like flu infection from other kids can really drag her down, not like a normal child, because of her immune system is quite low. But in general, she's a very loving child. That's the best thing I like about it is, I don't want to say that I like the situation, it's just that this condition is kind enough for it to not be visible. It's not something you can see from her and say this child is sick. That's the only kindest thing that this condition has on her. You can clearly see she's just all over the place.
And you have really good hair. Karibu sana. Okay, guys, we want to take a short commercial break, and we've heard about aplastic anemia. It's a very rare condition, but we've gotten to know the symptoms and how it occurs. And after the break, we're coming back with the treatment plan and how actually after the surgery, how are things going to be? I hope it's going to be just a good, inspiring story for Ayla, for baby Ayla. So stay tuned. We are coming right back. Welcome back. If you're just joining us, remember this is Health and Wellness. My name is Zaitun Ali. And remember the hashtag on X is hashtag Health and Wellness, hashtag KTN Welcome Home. And the SMS line is open, 22151. It's free of charge. You can let us know if you have any question about this condition, any question to Stephanie or our doctor. So on set, I still have Dr. Gitau and Stephanie and also Ayla and our audience on the right. So as we're talking about the symptoms and everything about aplastic anemia. Right now, we really need to know the treatment plan.
Maybe we talk about testing first, how we diagnose the condition.
Okay.
As you heard, she went to different facilities and it was difficult. I think the first thing from our side, from the medical side, is the doctor who is, the medic who is taking care of her needs to have what we call a high index of suspicion. Okay. For a small child who's come severally with those symptoms, recurrent infections, now bleeding, you need to find out what is really causing this. And usually we start with simple tests, the one we call a complete blood count or a full hemogram, and you're able to see the different cells. So you're looking at the platelets, are they low? You're looking at the white blood cells, are they low? you're looking at the level of hemoglobin, which usually indicates that there's a problem with the red cells. So from just looking at those 3 cell lines, if, for example, all of them are low, then that should indicate there could be a problem with the bone marrow. Then we go ahead and do more tests. So we check, one of the other causes we mentioned is nutritional deficiency. So you find there are people who have like folic acid, low levels of folic acid, low levels of vitamin B12. So we look at that. Then at the same time, we are trying to come up with a diagnosis, we're also trying to rule out other things. Yeah. So we look at the liver, we look at the spleen, so we'll do ultrasounds before we end up now with what is called the definitive diagnosis, which is the bone marrow. So through a bone marrow now, you're able to look under the microscope, and the pathologists are able to tell us if, for example, what they will see is there's reduction in the level of the bone marrow. So we're able to see those cells that indicate that there is a problem there. So, and from there now we're able to know with association of the raw cells and the defect in the bone marrow, then that's what actually confirms the diagnosis of aplastic anemia.
Okay.
So once you've made the diagnosis, the initial treatment plan is usually supportive. And by supportive, as she was saying, that's what she was getting, and that's what has sustained her up to now. Okay. So if, for example, the person has low blood count, the same thing we do with all anemia, so we'll give them iron supplements to try and boost the levels. We ask them about the diet, so eating more diet rich in iron, yeah. So the green kales, the meat, liver, all those that will help to boost, try and boost what they have. Though it's not curative, but it sustains them. Then we look at if the blood is very low. So sometimes we are forced to do a transfusion.
Yes, which you did, yeah? Yes.
Yeah. So if the blood is low and she has symptoms, then you're able to go ahead and do a blood transfusion just to try and boost these cells that are low in the body. Okay. And then for recurrent infections, we do preventive measures. So wearing a mask, avoiding handshakes, washing your hands frequently, because then all these predispose one to recurrent infections. So yeah. Just the same measures we had during COVID. So that's what we tend to tell the patients, that avoid crowds, avoid that a lot of interaction. And it's difficult, especially if it's a child, they have to go out and play. And any injuries, you ask them that as much as possible they be able to protect themselves from any injuries, because then they're at risk of bleeding a lot because of the low platelets. So once we do all that supportive treatment, there's also medications. We call them immunoglobulins. Sometimes they're able to go and help the bone marrow to try and produce more cells. But these are just supportive treatment. It's not the cure. Yeah. The cure is actually doing a bone marrow transplant.
Now what she's getting into.
Yes, yes.
Okay.
Yeah.
Okay. When is that?
We are hoping before the month ends, because right now we are still trying to gather funds. It's not cheap. Yeah. It's quite something on the financial side.
Perhaps you can tell people how you're trying to gather funds, because
yes,
someone can help. Yeah.
So right now there is a pay bill number going on. I think it's right there. This is the whatever amount. It really does not matter. There's no specific amount. I'm really just out there talking to any mother, any sister, any brother, any father. Whatever amount it is, we're just open. We're really trying for Isla to get her treatment done. Yeah. Because the more time we are at home, the more damage we're adding into her bone marrow. Because as per what the doctor has mentioned, also doing a lot of blood transfusion and platelets transfusion is also risky. That is what I'm aware of. So we're really trying to, by end of month, we would have taken her to India.
Yeah, yeah. Okay. Thank you so much. And Daktari, as she's preparing, and perhaps maybe there's a parent out there or someone who is suffering the same condition, as they're preparing to go and get the transplant, what are the factors that you need to keep into consideration?
Yeah, so it's a whole process, and I'm sure maybe that's what they're going through. So one, you want to, of course, identify a donor, and because it's a transplant.
Oh, yes.
So they have to make sure that the person donating does not have any other condition. So there's a donor preparation. Then there is the patient themselves getting prepared, making sure that if there are any infections, if low blood, so you try and boost as much as possible, so that by the time they are going into for the transplant, then their body is receptive. There are several things that usually now once the transplant has been done, that usually take place. One of them is, of course, they have to be observed and be kept under isolation, because they are still at a high risk of getting infections. We also want to monitor and see whether they are rejecting the transplant, to try and see if there's anything that would cause rejection. So it takes a long, sometimes people travel and you find some may stay there even for up to 9 months or more. Like if they're traveling to India. Unfortunately, we don't have the procedure in the country yet, but people have to travel to India or any other country for this transplant. And all they are doing, so they'll be under a lot of medication also, to try and reduce it's called the graft versus host disease, where what you've received, you're trying to prevent it from reacting with your own cells. So they get a lot of immunosuppressants. That's why the risk of infection is very high. So they're observed, and then once they are stabilized, then they are asked to come home. Now they'll continue with medication that will suppress the immunity as well, to prevent the rejection.
At this point, I just want to give a chance to the audience to ask a question or two to the doctor or even to Stephanie. Karibu.
Thank you so much. This session has been very educating, and actually this is the second time I've gotten to know this particular rare disease. So thank you so much, and it has been an inspiring session. So I just wanted to ask the doctor, is hemophilia also a factor to consider when we're talking about this particular anemia? Thank you.
Thank you so much for that question. We didn't get your name?
My name is Sharif Ahmed.
Thank you.
So, so there are many types of anemia. So hemophilia is a type of anemia as well. It causes anemia. It's one of the causes of anemia, and that's what I was saying when you're trying to diagnose what is causing for example, before you arrive at aplastic anemia, you're looking at every other factor.
Yes.
So you're looking. So among the blood tests you are doing, there are several. They're called. There are certain factors like factor 8 that helps with the red blood cell formation, and people with hemophilia, they tend to lack those. So when you're doing the test, you're looking for all those. In fact, when you do even a simple blood count, complete blood count, among the things you look for is the type of cells that are under the microscope. So just from that, you can tell the kind of or what you're expecting in different conditions. So hemophilia is a type of a blood disorder where your blood tends to clot a lot. So you find these people, even small bruising, they'll bleed because they don't have that factor that helps the blood to clot. Yes.
Okay. So it is a factor that...
So among the tests, as you're getting evaluated for any kind of anemia, we try and rule out all these other conditions.
So for her, hemophilia is not the case at this point?
For her, most likely they've ruled it out as a cause of the aplastic anemia.
Okay. Yes. Thank you so much for that. Any other question?
Thank you. Mine is not really a question. Mine is to everyone who's out there. Now that they've come out, you know, it's one thing to know that your kid is suffering from the same, and it's one thing to come out. So that's very bold of you. Thank you for that, because I think now people will be much aware of this. So one urge I have, I think, for the government is to create more platforms like for people like her to talk about the same, because now at least she has some idea of what is going on. there's another mother maybe like her who's at a very remote place, who's just seeing a kid going through this, and then they're trying mitishamba and everything, and nothing is working. So I think the government should create a much good avenue for such avenues for people to speak about the same, so that we may have awareness about the same. Thank you.
Thank you so much
Thank
for
you.
that. And perhaps, Stephanie, let me ask, have you come in contact with any other person suffering from the same condition?
I have not. I would really, really like to any parent or anyone really, if you are going through this, please reach out to me, because for my sake, for your sake, I would like to also get a community of parents that are going through the same, because it's very hard for me as a parent to go and speak to someone who's totally unaware. I can go and mention this to one parent, and the biggest thing they'll tell me is, mpatie mtoto maini, mpatie mtoto mboga, but in the real sense, once you understand this situation,
yes,
you get to understand that no amount of food, no amount of whatever value that food, no matter how cheap or expensive, it's not going to act as medicine to the whole condition. It would be really, really helpful for us all to be able to just show support to each other, so that we can also get to understand each other. If I hear from somebody else, because in as much as I've spoken about all the symptoms, as also Daktari has mentioned, people go through different experiences.
Okay.
As he has mentioned, maybe some kids can bleed out from anywhere. For my daughter, it was only from the nose. Maybe from somebody else, the child was bleeding from the ears, because I hear you can also bleed from the ears also. You know, things like that. I would really like to have this community, because for me to hear something known as aplastic anemia, it's an experience that I'm going through medically for my daughter. So it would really be nice if you just come out. I'm a very open lady. I am very talkative. So to anyone out there.
Clearly from your t-shirt, I can see you've become a champion.
Yes,
in this family.
the t-shirt really is just to create the awareness, as he has mentioned. I really want to reach out. There's more of these. I can also give out to the families that are also experiencing the same, because, you know, as I put it on, I will walk outside and somebody will definitely see this, and because it's red, the first thing that people are used to is the ribbon for AIDS.
By the way, I was so confused, and I was about to say that, and I felt it will be insensitive.
Not
but
really.
Yeah, you know, that symbol.
Yes.
I was to ask, but okay.
So the symbol, really the exact symbol for aplastic anemia, it's on one side it should be white.
Okay.
And that's the exact symbol for aplastic anemia. There is the poster for my child for the whole contribution chart. You'll see the logo. It's half white, half red.
Okay.
So basically, it's just like how cancer's ribbon is pink. So I wear this shirt because I know out there somebody will be very curious and someone will ask me, what is that? And to be honest, I'll be very open. I would really like to get approached by anybody, really. And for me, I would even spare 10 minutes to just sit down and talk about it, because it's quite an experience and I know I'm going to see more
after this show.
Yes.
Definitely. Yes. And it hits hard when it's you who are experiencing it. But I'm sure more awareness is being created on this platform today. And I want to take one last question before we wind up the show.
As Isla's mother, how are you taking care of yourself? How is your mental state? How has this journey been for you?
That's a really good question. It's a question that triggers a lot of emotions, because at this point, I feel like if I didn't have a lot of support coming from my family and friends, if I did not have the strength to talk to people, I tend to be secretive. But when sometimes I get overwhelmed, I really feel like the need to speak to people. In as much as I will somebody will encourage me and say, things are going to be fine, things are going to be all right. Sometimes I'm sorry to say to the family and friends who tell me you're going to be fine. There's moments where at that point I'm not okay. And the only thing I feel I need to do sometimes, I do something I don't do constantly. What do? I live in Mombasa, so most of the time I go to the beach. I take very long walks. I try and occupy my mind by just doing light exercises. And I do a lot of spiritual inner search. Like I just have to sit somewhere and have I don't pray per se, I speak to God. I speak to him in terms of not asking him why. I believe.
Don't worry. And we declare total healing.
Okay.
Yes.
I believe that if I talk to God, he's not going to give me the answer. He's going to just calm me at that very moment, because there's no amount of you're going to be fine that will calm me. It's going to be more of breathe in, and then I just gather myself and say, okay, now. And to any parent going through this, please do not break down in front of your child. The best, even if you have to scream in a room by yourself, do it, but don't let your child be aware of what's going on mentally. It's not something that you want to put your child through, because it's also going to weigh a lot of questions in your child. So basically, I just do those three things. I meditate and I speak to God, really. And once I'm done with that, my heart is calm, knowing that I trust and believe in God that things will turn out great.
They will, actually.
Yeah.
They will. Thank you so much. Thank you for being a strong pillar to Isla. You see how she's playing? She's very okay, not even disturbed, and it's because of the support that you're giving to her, and also your parents. You said your parents as well.
Yes.
And your family. So it will be okay, and I'm sure it will be a success, the transplant. So at least let's go and find this help. And perhaps you've mentioned as well on what she should look out for immediately after the transplant. Make sure you just follow the doctor's advice. Yeah.
Yes.
So at least we've gotten insightful statements about this condition, and we are really grateful. And maybe you can tell people where to find you, Daktari.
Yeah. So as you mentioned, naitwa Daktari Msafiri. That's what most people know me, and it's because we go to people's homes. We also travel a lot with patients abroad, to India, South Africa. So that's actually where the name Daktari Msafiri. So anyone wanting doctor house calls, we do that. We are based at Parklands. It's called Park Medical Center, first floor. Our clinic is called Rehan. You'll find us there. Yeah.
Okay, thank you so much. And Stephanie, maybe your handle on IG?
My handle is Ephanie, EPH_3_ANIE. That's where you'll all find my daughter's chats. There's really a lot of information about what she's been experiencing. You will also get to understand, for those who don't know, you will also get to understand what my journey has been. So yeah, I can't really wait to indulge with you people.
That's beautiful. You document every single step of the way.
Yes.
Yeah, and I'm sure someone will benefit from that, definitely. So you can find them on their social media platforms. For us, it's at KTN Home. And for me, it's at Ali_Zaitun on Instagram, and on X, it's Zaitun Ali. Thank you so much for tuning in. And in case you missed this episode, YouTube immediately on KTN Home, you will find it. So see you next time. We've been filming from the Hotel Troy right here at Magadi Road. Thank you so much for joining us.
Ngishaya ngaphakathi dale nguwe, uthokozisa